As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community. All right, welcome back to Your Health with Terrebonne General Medical Center. You've seen Dr. Walker on our program many times on the left and Dr. Edgar Feinberg, cardiovascular thoracic surgeon, on the right. Gentlemen, welcome to the program tonight.
Thank you.
Welcome.
And a little cold outside, I take it, huh?
Oh, yeah.
And Doc said it was a little cold in the studio, too. So anyway, well, it's American Heart Month. And Dr. Walker, first of all, heart disease. Again, just simply, what is it?
Sure. Well, to start with, there are many, many forms of heart disease. We can have weakened heart muscle. We can have problems with conduction disturbance of the heart. We can have arrhythmias, valvular heart disease, coronary artery disease. But by far and away, the leading cause of death in America, if you take all causes of death, is heart disease. And leading amongst that is coronary artery disease, where the arteries which run on top of the heart and supply the heart muscle with blood become plugged up and actually cause heart attacks and issues such as arrhythmias. That's overwhelmingly the leading cause of death, more than all cancers put together, more than other things which people often think are more common. Heart disease is easily the #1 cause of death and disability in the country.
Okay. And Dr. Feinberg, statistics related to heart disease, can you give us a few of those?
Well, you know, in America today, there are about 800,000 heart attacks a year, and about half the people die from those. Another way to look at that is about every 25 seconds, somebody in America has a heart attack. And about every minute, someone dies from that. People with coronary artery disease, half the people who have coronary artery disease, their first symptom is a heart attack. And of those, half will die. So it's very, very important and incumbent upon people to be aware of their body and to go in and see their doctor and get their heart checked. Because, you know, we all know the risk factors, and if you're aware of your own body and know what's going on, it's important to get checked. The other thing is that about 500,000 people have a second heart attack every year. So it's a big problem.
I didn't realize there was that much, but it's staggering numbers. When you hear heart attack, a lot of people out there hear it, but they don't really know what it means. What is it? What's a heart attack?
Yeah, a heart attack, another name for it is a myocardial infarction. The heart's a muscle. It's a very specialized muscle that pumps and squeezes blood all over our body, but it requires its own blood supply. If it doesn't get that blood supply, then the heart muscle dies. And so the pump doesn't work well, and people can have arrhythmias. The heart becomes unstable. We have arteries on the top of our heart which supply the heart with blood. If, for some reason, these arteries cannot supply the blood, then the muscle starts to starve, and then it ultimately dies. Now, the most common cause by far for that, nothing close, is a buildup of atherosclerosis or of fatty material in the arteries, which starts to choke off the blood supply. And then ultimately that ulcerates and clot forms. That's by far and away the most common cause. But also causes can include, rarer than that is spasm. And rarer than that even is dissection of the arteries, where the arteries just suddenly peel like an onion. Those are very uncommon. But by far and away the most common is coronary artery disease from atherosclerosis.
You know, you hear people say often, Dr. Walker, that I feel like I'm having a heart attack, but how do they know if they are actually having a heart attack?
Sure, you don't always know, and the symptoms are not absolutely crystal clear. Dr. Feinberg brought up a point earlier which is very important. The first symptom is often a heart attack, and so the best thing is to have a high index of suspicion. If you have multiple risk factors, you should be evaluated for coronary disease. But the symptoms are as follows. The most common symptom would be chest discomfort, okay? And you may have had warning before because when you'd exercise, you might get chest discomfort or shortness of breath. But there can be atypical symptoms. One can have jaw pain or shoulder pain or neck pain or indigestion, where you feel really that it's something going on with your stomach, but it can actually be your heart because the heart lies on the diaphragm. And anything that irritates the diaphragmatic surface of the heart can make you feel like you just got an ulcer or something like that going on. You can just feel weak. You can feel nauseated. There are many, many symptoms, and unfortunately, particularly amongst diabetics, you may have no warning symptom at all. Some diabetics are having heart attacks and simply just don't realize it because the nerve fibers don't sense the pain.
Wow. Dr. Feinberg, who gets heart disease?
Well, you know, in America, I think it's really sort of culturally thought of as a man's disease. And, you know, and I think it's one of the things we're trying to bring awareness to is that, you know, heart disease and heart attacks, you know, affect women just like they affect men. And so, you know, it's not just a man's disease. It affects women. They're really about half of all cardiac deaths are in women. So just like half of us are, you know, women, you know, heart disease is the same thing. And if a woman is over 65, it's also the leading cause of death in women over 65. And it's the third leading cause of death from women who are in the ages, in the young ages, under 45. So, you know, it is an important thing for women to be aware of. I know that there are lots of other health issues that specifically target women, and so we then think that heart disease is a man's disease, but it's not. All of us have a heart, and all of us can have problems with it. So. All
right, very good. We're going to take a short break and hear from Terrebonne General Medical Center. We'll be right back with some more important questions, so don't go away.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Chilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
All right, once again, our guest, Dr. Craig Walker on the left and Dr. Edgar Feinberg on the right. And we're talking about American Heart Month and the heart. But Dr. Walker, how do you test for coronary artery disease?
Well, first thing, you should always suspect it. We know that certain things put people at risk: smoking, high cholesterol, diabetes, family history, high blood pressure. Those things put you at risk. So the first thing is, if you have one or more risk factors, you should think, I can get heart disease, because then it is clearly the thing most likely to kill you. Mm-hmm. Now, once you have that, there are a whole battery of tests. One test, and perhaps the one that most people know about, is the electrocardiogram, or EKG. But an EKG is only a measure of an electrical signal. And I have to tell you, you can have very advanced coronary disease and have a completely 100% normal EKG. If an EKG shows a heart attack, then you have coronary disease, but the opposite is not true. If it's normal, it doesn't mean you do not have coronary disease. Not shown here is a test that I'm very fond of now, the calcium score. Calcium score is a 10-second test in a CT which picks up the earliest form of atherosclerosis and allows us to intervene long before it's symptomatic. An echocardiogram using ultrasound, like a depth finder on a boat, can allow us to look at the heart muscle and valves, and it can be very helpful. A stress test, or a nuclear stress test, is a way to stress the heart to bring out lack of blood supply. At rest, your heart may get all the blood supply it needs, but if there are choked off arteries, as you exercise and the heart rate goes up and the blood pressure goes up, that may bring on these symptoms. We have CT angiography, which we can use today, which is a means by which to look at coronaries. Chest x-rays can be invaluable. And finally, the ultimate diagnostic test in terms of coronary artery disease is the coronary angiogram. We do that in the hospital, wherein we stick an artery either in the leg or the wrist, and we advance catheters into the heart and inject dye into these arteries and make x-ray pictures. That's the absolute gold standard test for detecting coronary disease.
All right. And Dr. Feinberg, what diseases and conditions would put my heart at risk, or anybody watching tonight? What would happen there?
Well, you know, the single most important risk factor I think that people can control, that they can control, is cigarette smoking. That's something that people can do something about. Whether or not you carry too much weight, you know, if you're overweight, obesity is clearly an important controllable risk factor. Certainly things like high blood pressure, high cholesterol, those are things that you can control. While you may have those diseases, you can see a doctor and get them treated. And if you get them under control, then they have less an impact on whether or not you'll develop coronary artery disease and then subsequently a heart attack. Peripheral artery disease, which is really the same kind of process that goes on in the heart but going on in other arteries, is a way to know that you may have heart disease too, because if you've got problems with arteries to your legs or arteries to your brain, the carotid artery, then chances are you almost certainly have the same process going on in your heart. So, because these things all occur within our body and it's part of the same process. And of course, irregular heartbeats, any symptoms of heart failure, history of heart failure, or things like that are also risk factors. But I think the thing I really think that most people could make a difference in their lives is if you smoke, quit. If you don't start. And eat smart and eat right.
Yeah, very good points. And prevention of heart disease. Dr. Walker, how do you prevent it?
Yeah. Well, I think Edgar's just mentioned many of those great things, but we can't do anything about our family history. Once we're born to those parents, we've got their genetics. But we can absolutely control blood pressure. And it's not just controlling a number, it's how we control it with certain medicines. We can control cholesterol. Diet is part of that. We now have a tremendous armamentarium of medicines that can really lower cholesterol. And in fact, it has been shown now in multiple studies that we can not only stop the progression of disease, we can cause regression in many patients. Diabetes, better control of diabetes is very important. Cigarette smoking, getting off of cigarettes is absolutely crucial. And appropriate medicines, drugs such as aspirin or Plavix, drugs which can block the clot formation, which is the final common pathway of a heart attack occurring, can make a big difference. And things which allow us to reduce mental stress. We can absolutely, if we intervene early enough and make the diagnosis early enough, stop this disease from progressing. That's why I think it's so important to have a high index of suspicion. If you have risk factors, in particular a family history of heart disease, get evaluated. It's simple in today's world, it's relatively riskless, and it's a way of knowing what you have, and then you can start on a regimen to prevent heart disease. Edgar and I both treat advanced heart disease. He surgically, I with intervention. Right. But both of us will tell you the best treatment is to stop it before it occurs, to do prevention.
Right. Dr. Feinberg, high cholesterol, high blood pressure, diabetes. People out there with these diseases, they can lower their risk, right?
Yes, absolutely, and Dr. Walker referred to this. If you have conditions like that, like diabetes, like hypertension, and like high cholesterol, you need to stay in touch with your doctor. You know, just because you take the medicine for 6 months, well, we see this all the time, patients take the medicine for a few months, they go to the doctor, things get checked, it's all down to normal. They make the mistake of thinking, well, now it's gone away. You know, so I used to have high blood pressure. Well, no, you always have it. You need to stay on your medicines. You need to stay in touch with your healthcare provider, and you need to be screened periodically to make sure that if things are developing, you stay on top of it. Because the key to life is to preserve the heart muscle, and we can do that with the technology and the medications that we have today if we get to you fast enough to prevent the heart attack.
I want to thank both of you for coming in, but Dr. Walker, you always say it, educating people is the way to go nowadays.
It really is.
Teaching them the right and wrong way, right?
It really is. It's about prevention, and then if you have the disease, it's about getting in as early as possible, not waiting at home thinking it's going to suddenly get better. When an artery shuts off to the heart, every second heart muscle is dying. How soon we intervene, how quickly we get to that patient, how quickly we restore blood flow determines whether that person lives or dies, or whether that person has significant disability or not. So the key to this is a high index of suspicion and getting in as early as possible.
You're trying to make me go jogging, aren't you? Exercise, huh? Thank y'all so much for being on the show tonight. I really appreciate it. We're going to take a break. When we come back, we're in the Canada's kitchen, so you won't want to go away. And maybe some of that food they're talking about, who knows what they're cooking, but I'm sure it'll be good. We'll be right back.